Welcome to the American College of Surgeons Bulletin Brief from the Front Lines, Surgeons' Voices. With me today is a return guest and a longtime friend who lives just one county south of us in Dade County, and I'm here in Broward, Dr. Henri Ford, who's Dean at the University of Miami, Miller School of Medicine, and a fellow regent in my class of regents. We're getting near the end of our third and final terms.
Don't say it, no.
Very.
I'm doing it after all, yeah.
Yeah, it's was a great 9 years, but it goes by like the blink of an eye. But today I'm going to talk to you not about the Board of Regents or about University of Miami or Cleveland Clinic, but about the annual program for the American College of Surgeons. And you have been for many years a superlative, outstanding, innovative program chair. Last year, you very deftly and quickly turned around from an in-person program to a virtual program, and maybe you can share some of the successes of the 2020 virtual program with us.
Well, first, as a point of departure, let me say, even though we're not supposed to talk about the Board of Regents, what a privilege it has been to serve on the board with you over this past 9 years. You have been a source of inspiration, a role model, and truly an innovator in so many ways. You have advanced the mission of the college beyond anything imaginable, especially when it comes to our reliance on social media and just being beyond all the other things that you do as a colorectal surgeon. So thank you for this privilege. And certainly this forum that you've provided for us to continue to have a narrated discussion about pressing issues has been invaluable. Last year, we had to pivot fairly rapidly, as you noted, to change the clinical congress into a virtual format. It took a Herculean effort by everyone, especially the members, the dedicated members of the Division of Education and everyone else at the American College of Surgeons to pull off this incredible feat. Whereas we typically average, closer to 10,000, 12,000 attendees in recent years, we had well over 30,000 and somewhere close to 32,000 plus last year. And more importantly, we're not just done after that week of the clinical congress. Our fellows and registrants had the capacity to continue to access the clinical material well into the year 2021. That's unprecedented, and certainly this was an added benefit that the fellows have really praised. And so it opened our eyes as far as the possibilities are concerned. We had for long wanted to make sure we immortalize a lot of the important material that is presented at the Clinical Congress. And COVID-19 forced us to adapt very quickly. And now we are able to do so. And I'm happy to say that for Clinical Congress 2021, all of the registrants will be able to access that valuable information that's going to be presented until September 2022. So that's quite a bit of time where we can go back and review some of the presentations that were particularly illuminating. Anything else that you missed, you can actually go back or reheat it. And if you want to make sure you got a chance to hear everything that was presented or that's going to be presented at this year's Congress, you'll have 9 months to do exactly that. So there is no reason why you should not be able to enrich your knowledge base, because that's what we're all about. That's what the Clinical Congress is all about. Let me stop here and then ask you some more questions, but I'm getting excited already.
Well, that's great. And you got us all excited last year. And just before I broach any other topic, thank you for your exceptionally kind comments. And I can assure you the feelings are quite mutual. I have the utmost respect for you. I've learned a lot from you, your contributions to the regions. have been, in my view, absolutely fantastic. And I hope that we continue to interact and learn from each other. So it's been a pleasure and a privilege working with you, Henri. In terms of the program, your excitement, infectious enthusiasm, shall we say, very justified. Last year, you turned on a dime, as you mentioned, very quickly, turning a battleship with all of the program committee and all of the staff in the education division at the college. Everybody just did Herculean work getting it done. The program was superb, despite the short time and the need to change format. This year, with a lot more lead time, I expect the program is going to be that much more robust and that much more superlative in content, because it hasn't been turning on a dime. It's been a ramp up, and I imagine it's going to be an absolutely unparalleled, extraordinary program with you at the helm and the same energetic people working with you. So maybe you can tell us a little bit. You mentioned about registering, so maybe we can start with that. Who should register? Who should be logging on to the ACS website and registering for the Clinical Congress?
What a great question. The purpose of the Clinical Congress is to meet the needs of all learners. I mean, I think I really want to emphasize all learners. We are trying to cover the entire spectrum, from pre-medical to medical students, residents, fellows, associate fellows, established fellows, and even senior fellows. The whole idea by the Clinical Congress is to focus on the latest advances in surgical science, practice, and education. And this year, all of those themes are being tied to the overarching theme that our president, Wayne Meredith, has chosen, which is resilience in the pursuit of excellence. This is what the American College is all about. It's really about the pursuit of excellence from the time you are a pre-medical medical student through residency, fellowship, and beyond. So that's what we are going to try to cultivate. We are encouraging everyone to actually join. To register, if you have not yet registered, it's not too late, because this year what we have added is the postgraduate didactic courses as well as the skills courses. Last year we were not able to offer these, in part because of the turnaround. It was just, we had such a limited time to pivot. But this year we did add the postgraduate didactic courses, and I know you all are going to be teaching one of them. But we also added the skills courses, although at this point we can only focus on the didactic component. The actual practical aspect for the skills course will come at a later time. So please, just about anyone who wants to advance their knowledge, anyone who wants to be equipped with the necessary tools to achieve the best clinical outcomes and advance their career, they belong at Clinical Congress 2021.
I wholeheartedly agree and commend everybody to go to the website, the www.facs.org, and click on the program. It's the upper banner, and register. In terms of the didactic courses, yes, I feel very privileged and honored to be able to co-chair one with Dr. Patricia Silla from Mount Sinai in New York. And Patricia and I proposed a course the program committee kindly accepted on fluorescence imaging, and it's very clever the way that the program committee and Dr. Sachdeva and the Division of Education constructed it so that the registrants for that didactic course will view all of the talks in advance of the actual session. So kind of their homework, as it were. Then the program itself is completely interactive. So then that block of time, which I believe is just under 2 hours, will be devoted to answering questions from people who've seen all those talks. So it's a nice block of time to really interact with surgeons at all stages of career from all over the world to really make sure people understand the information. And if memory serves correct, there's even a follow-on after that where we'll be able to see how practice may have changed by virtue of participating in the courses. So kudos to you, my compliments for this very clever design of material. Besides the didactic courses.
Now I was going to say, just after listening to you, first of all, that's the epitome of the concept of the flipped classroom, because you get to look at the material, practice it, and then show up for class and ask questions. And by the way, I did not miss the fact that there was a gratuitous advertisement for the course that you will be leading. So great going.
Well, I encourage people to take any of the didactic courses. I only know about that one though. So
No.
giving a pitch for Dr. Silla at Mount Sinai. But I would say the design is very clever. And as you said, not only homework, but like any course one would be taking at a university, for example, you can go back and look at it later. So after the session, as you said, 9 months, the material's there. So you can say, gee, I didn't catch that point. Go back and look at the lectures for the next 9 months. Fantastic. Real great opportunity. In addition to the didactic courses, the skills courses, the fact that the meeting should appeal to every single member of the surgical and pre-surgical community. There are also named lectures at the college, and maybe you could delve into some of the details of this year's named lectures.
No, it's a great point. I am delighted to report that this year's Martin Lecturer, that's the kickoff lecture, is going to be delivered by none other than Dr. Fauci from the NIH. We know that Anthony Fauci has been really the leading sage voice in the COVID epidemic or pandemic. And it's going to be great to have him kick off Clinical Congress 2021 for us by giving the Martin lecture. And then we believe he's going to be available unless something happens, of course, at the national scene. We should be available to answer questions at the end of his talk. So that should be truly special. We have a number of other great talks to mention. In particular, the basic science lecture, the Ravden lecture, which is going to be delivered by Dr. Melina Kibbe. We also have the J.J. Cunley Ethics and Philosophy of Surgery lecture, which is going to be delivered by Michelle Hopper, who is an emergency room physician who has written extensively about about race, ethnicity, and health disparities. The Scudder Oration is going to be given by one of our former Board of Regents colleagues, Dr. Lenworth Jacobs, who has done a whole lot, especially in the area of Stop the Bleed. We know he played a pivotal role in that act, so that's a great honor to our Len Jacobs. I could continue and on. The Olga Jonathan lecture, which really honors one of the iconic figures, women figures in American surgery, in Dr. Jonathan, is going to be given by Dr. Andrea Hayes Jordan, and the Excelsior lecture to be given by Dr. Alan Kirk, and on and on. So I'll stop here because again, I don't want to just monopolize the discussion here. But you can see a lot of outstanding leaders are going to be represented in our named lectures.
Speaking of leaders, one of the facets of the college has always been, and you just mentioned it, the opening ceremony and also the convocation. Will some of the leaders from other countries who are typically sitting on the podium be involved, and if so, in what way?
The tradition has been for us to honor to give honorary fellowships to a number of dignitaries from other countries. And I believe all of that is planned, and this is usually part of the actual convocation, initiation of the new fellows. And so it is my understanding very much that the President, Wayne Meredith, plans to actually carry out that tradition.
Yeah, and I think the college has been really diligent in trying to identify deserving people from a very diverse group of surgical disciplines, geographic locations, practice types, every aspect that they possibly can. And I believe the same is probably true this year. just give you the opportunity to mention anything else that you might like to raise before we close today.
Well, I always like to say that preparing for the clinical congress is an enormous task. There are so many people involved, and the program, setting with the program committee, and everyone always remembers how much I talk about how we make the sausage or the soup, the gumbo, however you want to describe it. But it's a lot of work on studying with all of the fellows and participants who submit their abstracts, the enormous amount of work that goes on preparing these submissions for review by the program committee, the selection process and the way it takes place through very thoughtful deliberations in order to ensure that we provide the very best material to enrich the knowledge base of our fellows, and of course, the amazing staff of the American College of Surgeons. We could not do this if it weren't for everybody's dedication. So I always like to take a moment to pause and acknowledge the program committee, the advisory councils, the standing committees, all of whom have made extraordinary contributions to this year's Congress. And of course, the hardworking, indefatigable staff of the American College of Surgeons, and of course, especially the Division of Education and SACH and Dr. Sachtiva. These are the people who make it possible for us to offer the clinical congress and make sure that we offer a high quality program every year. So thank you.
Well, thank you. Thank you for all that you do for all of us fellows by virtue of chairing the program committee. Looking forward to an absolutely superlative meeting and being able to enjoy it until September of 2022. So
excellent.
Thanks again, Henri. Great chatting with you.
Sure enough. And remember, you can collect 200 CME credits up until February 1st, 2022. So another reason for you to make sure you are participating in Clinical Congress 2021. Don't miss it.